I'm here with Dr. Anthony Smith from the University of New South Wales, speaking about his qualitative research on mpox. What were the key findings from your research?
So the key findings from the research were that people not only experience mpox as a really distressing acute illness, different severity of symptoms, but also that there were long-term consequences for people in terms of physical and mental health. So that included psychological health, mental well-being in terms of some of the poor care that people reported experiencing. But also scarring and other rectal complications, some of which required surgical intervention.
So during the 2022 outbreak, we heard a lot about that acute phase of mpox, and I was just wondering what some of the longer term after effects are, especially now a whole year later. Could you tell me more about that?
So mpox had longer term effects for some people. This included scarring, rectal complications that required surgical intervention, psychological distress, and also just slight shifts in the ways that people thought about themselves, their future, and what they might want from sex.
So you touched a bit on the stigma, especially emanating from healthcare providers. Can you tell me a little bit more about that and what the implications are for any healthcare providers reading your research?
So mpox was a perfect storm for stigma and discrimination. It's a disease that's linked to sexual practices. It involves anogenital symptoms, especially in the 2022 outbreak. It affected an already marginalized community. And we already know that health services are not always very well equipped to deal with questions of sex and sexuality. And there was also this fear of casual transmission and contagion. So all of that together meant that mpox was a perfect storm.